My name is Dr. June Amundsen. I'm the Assistant Dean for the College of Nursing at the Prince Albert site. And as many of you know, nursing students can graduate with their baccalaureate degree and take all 4 years at Regina, Prince Albert, or Saskatoon. The profession of nursing is going through some exciting changes throughout Saskatchewan. And over the next few years, we will be increasing the number of students graduating from this province with their baccalaureate degree. In order to prepare for this increase of students, Dr. Lorna Butler has been going throughout the province meeting with leaders who work with our students every day. This fall, Dr. Butler and I joined the Northern Medical Services team to fly to Crosse and to meet with key players working with our students in the health center there. In the next clip, you'll have an opportunity to hear from one of our very own NEPS graduates, registered nurse Doria Offrey, who is presently working at Crosse.
Hello world, my name is Sasha and I'm a 4th year NEPS student here in Saskatoon. I'm here to interview
Doria,
and just to ask her a few questions about her experience in Crosse and what she does in her spare time. So I guess we will begin. So Doria, can you tell me a little bit about yourself?
Well, I graduated in 2004 from the NEPS program here in Saskatoon, and as of late I've been nursing up in Crosse since the start of August, and yeah, I've really enjoyed it.
Awesome. So can you tell me where Crosse is located in Saskatchewan?
Yeah, it's about 4.5 hours depending on weather, northeast of Saskatoon. Yeah, and no, northwest of Saskatoon.
Yeah.
And yeah, it's a little Métis community up there that has about 1,300 people, roughly.
Yeah.
And yeah, it's a lovely community.
So I was just wondering, why did you decide to go to Crosse?
Well, I've been nursing it. I'd like to change my job about every year. And I've been wanting to do northern nursing for pretty much since I started nursing.
Yeah.
And I've had some friends go up there through the medical program, and they said it was a really good place to learn, a good place to start if you do want to do more northern nursing. And so I applied, and they responded very quickly, as they need lots of nurses up there. So I decided to go.
Awesome. So what do you consider northern nursing? Like what do you do on a typical day? What sort of things keep you busy in Crosse?
Like for
as a nurse?
Yeah,
as a nurse.
Well, it's a about 15-bed hospital roughly, and there's an emerge, a 2-bed emerge, and then also the hospital beds. So just general emerge nursing, which I'm new to, plus looking after the inpatients as well, and the long-term care patients as well.
Right. So are you only working in Crosse then, or are you also?
No, I'm also working about another hour and 45 minutes up in La Loche, north of Crosse, and I'm doing public health nursing there.
So basically you're doing acute care and public health, the best of both worlds, yeah?
I think so.
So what is your shift like then when you're working in northern Saskatchewan?
Well, I work 12-hour shifts in the hospital, and I do that for 3 weeks, and then I go up and do 8-hour shifts Monday to Friday up in La Loche as public health. So
okay.
I keep very busy.
Awesome. So what kind of things do you do for recreational activity to keep yourself busy and keeping the exercise going and that sort of thing?
Well, I live on a lake, so which is quite nice, and I have a kayak, so for pretty much every day of fall and up to November 11th, kayaking every day.
So I guess the next question is, if members of the audience are student or graduate students, what advice would you give to them if they are considering going up to northern Saskatchewan?
I think try to get a really good experience here in the hospital, getting your skills honed and that sort of thing, and trying lots of different jobs even down here as well. To not go up there, you know, as a new grad, I don't think right away.
Do you find that people assume that northern nursing may be a little bit more easier per se?
It's different. I mean, I think it's not as busy, so the acuity is maybe not as high because we ship all the high acuity patients out. But you really have to have a good knowledge base because people come to you and expect you to know about this, this, and this. You know, lots of different. You have to have a good broad base of knowledge. So it's not easy, It's definitely not easy, but it's different.
Mm-hmm.
It's just a different type of nursing, and I think having lots of different experiences before you go up there would
definitely be
positive.
beneficial. Yeah.
Because then you can draw on that, and people come to you, you know, some of the northern nurses come to you for advice on different things that you've experienced down south. And so it's good to have a lot of stuff up here.
Yeah. So when you went to Crosse, did you get a lot of orientation to the community, to the hospital, that sort of thing?
Not a lot.
Not a lot? No.
Not a lot. So you kind of have to be flexible and kind of just willing just to kind of learn as you go. Yeah.
So have you noticed the impact of the shortage of nurses in Crosse as compared to Saskatoon?
You tend to work more overtime up there. Yeah. Because there's just not that many people to draw on. Yeah, and you kind of, I mean, they just do that. That's something that they just expect to do. Whereas in Saskatoon, people are just like, forget about it, it's not my problem. But when it's your community, it's your hospital,
you kind of feel more
responsible to they need a nurse there, so you go in, which is good, I think. But up further north in the Losh, there's much more of a shortage there, which is kind of scary too.
Yeah. So are you the only nurse working then in the Losh?
Yeah, I'm the only public health nurse.
Yeah.
So I'm extremely busy.
Yeah. You like it then, I'm assuming.
Yeah, I mean, I'm learning a lot, and I'm forced to learn.
Yeah.
I'm forced to just
expand your horizons.
Yeah, people come to me and they expect me to know, so I have to find out.
Yeah, wonderful. All right. So is there any story you want to tell, or any great experience that you'd like to say about Crosse, or that you can think of?
Story, hey?
Yeah. Not necessarily a story, even comment about an experience that you have had while being in Crosse.
Well, the whole experience has been very positive. I mean, I've learned a lot about the Aboriginal communities up there. I'm trying to learn different, you know, the Dene up in the Losh and some of the Cree. And I don't have an exact story, but
so do you find it difficult to communicate? How are you able to communicate with members of the Losh who do speak Dene and English isn't their first language?
I use the people around me a lot. There's different, I work with the different people up there, some health educators that come with me most of the time, and they help me translate, and I'm sure they're talking about me half the time. Yeah. They're talking in Dene, and I'm like, I need to learn this language, because
I need to know what they're saying.
Yeah, but I mean, it's all very positive. They're laughing, they're happy, but I mean, it's a bit harder, especially with some of the elders, because they don't really want to talk to you as much because they don't understand you, and they'll just kind of smile, and you can do kind of sign language with them, and but it's nice to have someone who speaks the language, so it's kind of incentive to learn at least a few words.
Yeah. So can you say hello in Dene and hello in Michif?
No, not yet.
What about in Michif? No? Okay, how about we practice Tanse?
Tanse.
There we go, that's in Michif. Okay, awesome, Dory. I'd like to thank you for taking part in this interview. I don't know if you have anything burning that you'd like to say before we end.
Well, I think more people should go up north. That's kind of my thing. I really am enjoying it. I may never come back.
We may never see Doria again.
I'll come to visit, but it's definitely a very positive place to go. And it's been very welcoming, a very good experience in my 4 months that I've been there. So.
Okay. Yeah. Wonderful. Thank you, Doria.
Thank you.